Wait, was that 4 or 5? 2, 3, 4, 5. It's normal to have the urge to double check things. I mean, in reality, it's probably a good thing. So my wife has me get up after we've been in bed for some time to go make sure the cars are locked. Now, this requires me to get up, walk to our front door, and click the buttons on our key fobs and listen for a honk. Come to think of it, our cars are parked right outside our bedroom door. I could just leave the car keys on the nightstand. Huh. Note to self. Put keys next to nightstand. All right. So is her asking me to do this obsessive? Probably not. But what if she got up herself 5 or 6 times to make sure the cars were locked? Then she might be a little obsessive. But she's not, by the way. Or what if every time that I went to bed, I had to get up, go to and use the key fob to lock the car, but then I walked outside to check the car doors. Then I come back inside, click the key fob again to unlock the car, then walk back outside to make sure my wallet wasn't in it. Then I walked back inside, locked the car with the fob, then back outside to check the doors, and finally I could get into bed. This would be a compulsion. Obsessive compulsion disorder, or OCD, is a specific type of anxiety disorder characterized by obsessions and compulsions. Obsessions are recurrent, persistent, and intrusive thoughts that are typically unwanted by the person afflicted, but they are tough to get rid of. And because they are tough to get rid of, they can turn into compulsions. And the example I gave just a second ago, my obsession with making sure the doors are locked might stem from my car getting broken into in the past and my wallet getting stolen. So now I have this obsession about making sure my car is locked because I have an anxiety that it might happen again. And because of this anxiety, I've created a compulsion to try and reduce the anxiety associated with the obsession. It's like this vicious cycle of things. And imagine how difficult these obsessions and rituals would make it to lead a normal life. And yet, this is what people live with every day. Now, all joking aside with what I'm talking about or the examples that I give, it is a truly real thing. And people live their lives just feeling overwhelmed and obsessed and compulsed to do these things, and they don't want to do them. So what qualifies a person to be diagnosed with OCD? Well, number one, it takes obsession, compulsion, or both. We just talked about what an example of both of those would be. They have to be time-consuming. If I'm getting up every single night, or my wife is every single night, to go and check the car 5 or 6 times, it's time-consuming. And then, number 3, they cannot be a factor or effect of another substance or a different medical condition. And finally, number 4, it cannot be better explained by another diagnosis. My obsessions, my compulsions cannot be better explained by another diagnosis. In today's world, mental health providers are actually seeing a new type or a new clinical symptom of OCD associated with social media. And though providers are observing classic symptoms of OCD associated with social media and smartphone technology, current standardized symptom checklists are lacking. This according to Van Bonnekom et al. A 2022 journal article called Fear of Missing Out and Compulsive Social Media Use as a Mediator Between OCD Symptoms and Social Media Fatigue, authors Emma Fontes, Perryman, and Roy Spina characterized compulsive social media use as an abnormality in the control of behavioral consumption, with individuals being incapable of rationally managing routine behaviors. Further, the authors link social media compulsion with isolation and depression due to the onset of what they call fear of missing out. These people have a compulsion to continuously look at their phone and social media to make sure their friends aren't doing something that they are missing out on. And they have a fear of this, and it creates this anxiety. And the only way to reduce the anxiety is to continuously check a smartphone. And similar to other anxiety disorders, OCD is best treated through cognitive behavioral therapy. In the video, Obsessive Compulsive Disorder OCD Causes, Symptoms, and Pathology by Osmosis from Elsevier, it is suggested that one of the best CBT techniques is exposure and response therapy. In this, patients are first exposed to the anxiety and compulsion provoking situation and ultimately it's showing them that anxiety actually lessens over time when the compulsion is not carried out. But if OCD is untreated or left untreated, the compulsion can become even stronger. And in that, people start leaning into the compulsion as a coping mechanism to relieve the anxiety associated with it. Like I said before, it's a vicious cycle. And over time, the more a patient leans into the compulsion, the harder it can be to treat and the more life-consuming it can become.